Good morning, everyone. Thanks for joining me today. I chose to report on generalized anxiety disorder, or GAD, given my own history with anxiety and the growing prevalence of GAD that we're seeing in our society today. I wanted to use this assignment really as an opportunity to ensure that I understood the full diagnosis and the most successful treatment approaches for this disorder. First, I will cover the diagnostic criteria for GAD. Second, I will discuss assessment strategies for diagnosis. Next, I will discuss evidence-based treatment approaches and determine the most effective interventions for GAD. And I'll finalize this presentation by discussing how this research has enhanced my own understanding of diagnosis and treatment and discuss my personal reflections. A GAD diagnosis must meet a few criteria. First, excessive worry about the client is feeling must have occurred for at least 6 months about a variety of events in their lives. The client will also find it particularly difficult to control that worry. The anxiety is associated with at least 3 of the following 6 symptoms: restlessness or feeling on edge, being easily fatigued, having difficulty concentrating, feeling irritable, or experiencing muscle tensions or sleep disturbance. The anxiety or the physical symptoms cause significant distress or impairment in the client's life, and the disturbance itself cannot be attributed to the effects of a substance, nor is it better explained by another medical disorder. There are a few assessment strategies to support my diagnosis. The first thing I would do is to assess the general risk factors for developing GAD. These include having a low socioeconomic status, being widowed, separated, or divorced, being middle-aged, also increases the risk. And then there are additional factors to consider, like comorbidity with other psychiatric disorders, having a history of substance abuse or trauma, and a family history of GAD. Gender also may predispose an individual to develop GAD, as women are actually twice as likely to develop this than compared to men. After understanding these risk factors for diagnosis, I would then shift to a more individualized assessment strategy, which would take place during the intake session. I would start by administering the PHQ-4, which is the 4-item patient health questionnaire for anxiety and depression. This would allow me to screen for both major depressive disorder and generalized anxiety. Following that, I would then incorporate the GAD-7 questionnaire to hone in on the anxiety symptoms specifically, just to understand the severity of symptoms that the client is experiencing. Then it is important to be aware of any other comorbid disorders or determine that the client's symptoms aren't met by another disorder. For instance, one significant differentiator of GAD compared to other anxiety disorders is that these other anxiety disorders are often associated with a specific primary stimulus, where GAD is not. So this will help us differentiate between the two. GAD is also highly comorbid with other disorders like depression or panic disorder. And there are also some physical symptoms such as an increased heart rate, chest pain, dizziness that are also associated with GAD that need to be evaluated within the differential diagnosis. These physical symptoms, could be better explained by health diseases related to asthma, heart failure, thyroid disorders, or diabetes. Lastly, these symptoms of GAD could be related to a misuse of substances like alcohol, benzos, nicotine, caffeine, or other stimulants. So it is important to make sure you rule these out before administering a diagnosis. If all these criteria are met, however, I would administer a provisional diagnosis of GAD. So on to the treatment. Psychotherapy is the most known effective treatment for GAD. Cognitive behavioral therapy specifically is the most well-known and documented approach for GAD and is actually used as the gold standard for treating this because it is the only empirically backed treatment to date. The goal of using CBT is to work with the client to develop skills related to self-monitoring so that they can become aware of their anxiety cues or how to react in anxiety-provoking situations, and also how to identify these dysfunctional cognitions. This self-monitoring is related to cognitive, emotional, behavioral, and physiological feelings. So CBT then teaches these clients to become aware of both internal triggers that evoke these negative symptoms, as well as environmental cues and emotions and dysfunctional behaviors and cognitions that can elicit this anxiety. Once these triggers are identified, CBT can then be used to reinforce new and adaptive coping strategies. The cognitive restructuring is another really important component of CBT that helps overcome these distorted or dysfunctional cognitions. the cognitive component of CBT really seeks to challenge these illogical cognitions to introduce less anxiety, reducing ways of interpreting, oneself or the world that they're living in through logical analysis. Mindfulness-based interventions was another successful strategy that I came across in reducing the negative symptoms of GAD, really including excessive worry, stress reactivity, anxiety symptoms, and the inability to pay attention to certain tasks. For instance, one meta-study by Dahlin et al. Found that improvements in pathological worry were very significant following a mindfulness-based intervention compared to the control groups. Progressive muscle relaxation, or PMR, I also found was effective to let go of muscle tension that can serve as a secondary anxiety cue. Lastly, pharmacological interventions are also effective to treat the acute symptoms associated with GAD, and I found that this was most effective when used in conjunction with CBT. SSRIs and SNRIs are the recommended drugs for these treatments. So, to summarize, researching this disorder has really enhanced my understanding of how to identify anxiety and properly diagnose this within my clients. It has given me another tool that I can add to my toolkit to assess if a client is meeting the criteria for a diagnosis and to determine the level of symptom severity. And then lastly, it was really interesting to read about the most up-to-date and successful treatment approaches for GAD, and I found that I've been able to really identify that and will be able to utilize that in practice. Personally, this research has really helped me to identify ways to manage my own anxiety, especially through mindfulness exercises and ways to help me identify triggers before I fall victim to the anxiety spiral. Thank you so much for being here with me today. I appreciate the time. Please don't hesitate to reach out with questions.